Hello and welcome back to Questions from Quarantine. I'm Tara Tyrell and I'm here with Dr. Margaret Bourdeaux and Professor Juliette Kayyem of the Harvard Kennedy School. A question this week that we have received multiple forms of. Many are alarmed this week following Trump's move to strip the CDC of COVID data control. We're also seeing efforts by the administration to block funding, billions of dollars for funding in testing and contact tracing for states. I want to go first to Dr. Bourdeaux on her thoughts on this and then to Professor Kayyem regarding first the medical side and then of course the general planning and control side from each state. Margaret, please.
So you're right, Tara. There's been a lot of jostling and a lot of difficulty in getting everybody in the country on the same page of what needs to happen. We find ourselves at an absolutely critical moment where because we have been unable to really test robustly, stand up our contact tracing, promote uniform policies across the country like mask wearing, get the funding we need to make our buildings, our schools more safe, we're just not able to take the next step. And it's just been a very, very tough learning curve for some folks that really didn't want to hear that message. So now I think that things are very fluid. In terms of the negotiations around the funding for this, for the public health measures to respond to this epidemic. And I think I saw like 3 different headlines yesterday. So it's a little unclear.
Yeah.
I think what's becoming clearer is that a lot of the governors and senators, particularly on the Republican side, are far more in favor of making the investments that are needed to stop this than they were even 24 hours ago, a week ago.
Nothing like the polling to get their hearts in the right place. This is from the policy perspective. Okay, so obviously the CDC, who was managing what data was difficult. I mean, was really problematic because in the world of policy, if you can't measure it, you can't manage it, right? So what is happening out there, so that you know where to drive resources, what's going to be your strategic stockpile necessity. Do we have a second wave coming? None of that or all of it was potentially going to be managed by the White House. So we are definitely at a time in which the Trump administration, can't change the story, so we'll try to control it because the story's so bad. So I've been saying for 6 months they have no plan. I was wrong. They had a plan. This is the plan. This is the plan, right? Which is just hope it goes away, force it on the states. Or this is like this, we're seeing the results of their plan. There was a plan. Now, anyone rational would have said this plan is crazy, but what we're seeing is a concerted effort. It wasn't nonfeasance, it was malfeasance. It was a bad plan.
Professor Kayyem, while I have you, I just wanted to ask, I read an article today specifically about hurricane prep as we're seeing a particularly active looking hurricane season. How does that complicate this?
So I've been doing a lot of work on this, because at DHS is supposed to, rub your belly and chew gum at the same time. We're not in total lockdown right now. So we were a little bit more worried in March, but a couple things will change. I mean, one is the way we shelter will have to change because you just simply can't have that intimacy. If you've ever been in a shelter, so that means that either we're going to have to get other capacity hotels, Airbnbs, whatever else. It means that if we as between one of the biggest challenges is you tell people to stay at their homes or evacuate. As between those two, we're going to probably favor sheltering in place, which is people have been doing it, and just make sure they have the resources to support that. And then, but if an evacuation is called, it should be called early because people are used to being at home. They're still, as we all feel it and have talked about in previous episodes, there's still, a confidence gap. People don't want to be outside, and then making sure masking and everything is part of that. But it's going to be a challenge. And I will say, with all the challenges we have, the fact that the president is focused on protecting statues, of dead white Confederate men is like, you're like, what about that pandemic? What about those hurricanes? So
I think one other useful thing to just for folks to understand is that there's a reason why this pandemic cannot be handled state by state. And we're really seeing that play out with respect to the catastrophe around testing. So, if you want to control an infection, you want to know who has it. You want to know who in your most vulnerable populations has it. You want to know where it's spreading. And in order to do that, you need to have assets that you can deploy based on the dynamics of the epidemic. Well, but when you do things state by state, well, it turns out all of us are dependent upon the same companies to run tests. And so when one state is having increasing cases, another state might think it's doing well because its caseload is low, but actually the test that they're running to know who's infected is dependent on the same company that's providing testing for the high case rate state and the state where they have low cases. And that means that the state with low cases loses visibility because they can't get their tests turned around fast enough to know where the infection is spreading in their state. That means they have to play ball with the other state to figure out how they're going to share testing resources, how they're going to have visibility on the epidemic. So basically what it does, if we try to solve this state by state, it means we have no eyes on this epidemic. We don't have situational awareness. We don't have surveillance. We haven't got monitoring. We're operating, we might as well just stick duct tape over our eyes and cross our fingers and walk off the cliff, because that's what that amounts to. So they did have a plan, and it was a bad plan. It was a bad plan because it had really unrealistic understanding of what was going to be necessary in terms of governance.
Well, it's certainly frustrating that we're still dealing with these issues this many months into the pandemic, but thank you both so much as always for your expertise. And for you, the viewer, please feel free to hashtag questions quarantine for your chance to be answered next week. Thank you.